Hello all, welcome to Let's Learn Optometry. In this video, we will see about cover test. Cover test is done to evaluate the presence, direction and the magnitude of both latent deviation that is phoria and the manifest deviation that is tropia. There are three parts in the cover test, uncover test and the alternate cover test. In cover test, we discover any tropia and to differentiate between a phoria and a tropia. In uncover test, we discover any phoria. In alternate cover test, we discover the total deviation. Alternate cover test cannot differentiate between a phoria and a tropia. Some practitioners prefer uncover test, whereas others prefer alternate cover test to discover phoria. I personally feel that uncover test is easier to perform than alternate cover test. We also have objective and subjective cover test. In objective cover test, the examiner observes the eye movement of the patient, but in subjective cover test, we interpret based on the direction of the image shift as said by the patient. We commonly do objective cover test. We will see subjective in a separate video. Materials required and setup. We do cover test at both distance and the near. The room illumination must be sufficient to allow the examiner to observe the patient's eye movement. Target. For young patients, we use an accommodative target, usually an isolated letter which is one line larger than the patient BCVA in the poorer eye. For older patients, we use light stimulus. We also use light stimulus if the vision is very poor in the patient. Occlusion. We cover the eye during the test to remove the fusion reflex. A card or a cover paddle that is opaque and large enough to cover one eye should be used so that the patient cannot see through it. We can also use a translucent occluder through which the patient can only see a diffuse light without contours, but the examiner can see the patient's eye movement. We can also use the palm of the hand as a cover. The examiner should position himself to see the patient's eye clearly without interfering the view of the target. The most important aspect of the cover test is the control of accommodation. Under accommodation will result in overestimation of the degree of exophoria or underestimation of esophoria, which is opposite in over accommodation. The examiner should ensure that the patient is attentively seeing the target by repeatedly asking the patient to verbally tell what he or she sees. Outline of the test. Step 1. We search for any tropia with the cover test. Step 2. If there is no tropia, we search for phoria with the uncover test. Step 3. We perform alternate cover test to discover the total deviation. Step 4. We measure the amount of deviation with the help of prisms. Procedure of cover test. Instruct the patient to look at the target and keep it clear throughout the test. Cover one eye and observe the other eye for any movement. For instance, if we cover the right eye, we need to observe the left eye for any movement. If the left eye moves to take up fixation, it indicates the presence of tropia. If the left eye does not move, the next step is to cover the left eye and observe the right eye for any movement. If the right eye also shows no movement, it indicates the patient is having no manifest deviation, that is tropia. Then we have to proceed with the uncover test to discover any phoria. But if we see the movement in right eye, it indicates the presence of tropia. In this example, we can obviously see that the right eye is deviated inwards, that is an esotropia of the right eye. Here, the right eye is the deviating eye and the left eye is the fixating eye. Let's see what happens when covering these eyes. When covering the right eye, the left eye shows no movement because it was already fixating the target at the beginning of the procedure itself. Now, we take off the cover. Now we place the cover in the front of the left eye. As the fixating left eye is covered, the deviating eye has to move to take up the fixation now. So, it moves outward to take up the fixation. It moves outward because previously it was inwards. As the right eye moves outwards, the left eye also makes a conjugate inward movement. Now we take off the cover. After removing the cover, the previously fixating left eye comes back to the fixating position and the right eye goes back to the deviating position. After confirming the presence and the direction of the tropia, we have to check whether the tropia is unilateral or alternating. For easy understanding, I use the term good eye for non-strabismic eye and poor eye for the strabismic eye. When the good eye is covered, the poor eye will move to take up fixation. In unilateral tropia, upon removing the cover from the good eye, the poor eye will give up fixation and move back to the previously deviated position, and the good eye fixates now. But in alternating tropia, the poor eye will continue fixating the target without turning to the deviated position. That is, both the good and the poor eye will have good ability to fixate the target. This is the previously seen example of right eye esotropia. Here, while the good left eye is covered, the right eye moves out to take up fixation, but when we remove the cover, the right eye goes back to the deviated position and the left eye fixates now. This is unilateral tropia. Let's see an example of alternating tropia. This shows esodiviation of the left eye. Right eye is fixating and left eye is deviating inwards. When covering the fixating right eye, the left eye moves out to take up fixation. After removing the cover from the right eye, the left eye continues to fixate. So, if we cover the left eye now, the right eye moves out to take up fixation. After removing the cover, the right eye continues to fixate, that is, both the eyes alternates the fixation.